Your fluffy, purring companion, who was running around like crazy yesterday, now prefers sleeping 20 hours a day. Sound familiar? We often blame these changes on inevitable old age, but what if I told you that what looks like getting old might actually be hiding our own mistakes? Today, we're going to talk about the 20 biggest mistakes we, loving owners, make when caring for our senior cats, often without even realizing it. Some of these errors might seem obvious, but I promise you'll learn at least 5 things that will fundamentally change your care routine. And one of them might just save your pet's life. So get comfortable and let's check if you are making one of these critical mistakes. Before we begin, let's define what we mean by a senior cat. Vets generally divide a cat's life into stages. 7 to 10 years is considered mature, 11 to 14 is senior, and cats over 15 years old are classified as geriatric patients. It is vital to understand that aging in cats is a sneaky and often imperceptible process. In the wild, any sign of weakness makes an animal easy prey, so cats have evolutionarily become masters at hiding pain and discomfort. They will purr happily on your lap, even if their joints or teeth are excruciatingly painful. This is why our role fundamentally changes. We transition from being just an owner to becoming a sensitive observer, almost a detective, whose job is to notice the tiniest shifts in behaviour and habits that might signal a problem. Forgetting this is the very first and most crucial mistake an owner can make. So, the first major mistake people make is completely ignoring the scale. We often celebrate when our cat seems plump and eats well, or, conversely, we might assume that little weight loss will be good for their joints. But any change in weight in a senior pet, either up or down, is a major red flag. Sudden weight loss can signal serious illnesses, including hyperthyroidism, chronic kidney disease, or even cancer. On the flip side, weight gain is certainly not a sign of good health. It's a direct route to diabetes, heart issues, and significantly increased pain from arthritis. You should be weighing your cat at least once a month, ideally at the same time. Keep a simple log or journal and record those readings. If you notice a change in weight exceeding 5 to 10% in either direction, without any obvious reason like a change in diet, that is a signal to call your vet immediately. Do not wait for it to sort itself out. Remember, the scale is your most important home diagnostic tool, and neglecting it is frankly dangerous. Next up, let's talk about the outdated diet. Feeding your 15-year-old cat the exact same food he ate at 3 years old is like giving a senior citizen a steady diet of fast food. As cats age, their metabolism slows down and their nutritional needs completely change. They need fewer calories to prevent unnecessary weight gain, but they also need more highly digestible protein to maintain crucial muscle mass. Furthermore, many senior cats develop chronic conditions that require a specific therapeutic diet. For instance, kidney issues require food lower in phosphorus and protein, while arthritis needs supplements like glucosamine and chondroitin. If you continue feeding a standard adult cat formula, you could unknowingly be worsening the progression of underlying diseases. Always consult your veterinarian and choose a specialized senior diet that addresses the unique, individual needs of your cat. This isn't a marketing gimmick, it's a genuine investment in his longevity and quality of life. Now let's talk about taking a good look inside your cat's mouth. Seriously, one of the most insidious and common mistakes we make is ignoring feline dental health. We tend to rationalize it. His breath smells terrible, sure, but he's just a cat, right? Wrong. That unpleasant smell might actually be a silent cry for help. Tartar buildup, inflamed gums, loose or even broken teeth. This isn't just mild discomfort, it is constant, agonizing, and exhausting pain. Imagine having a relentless toothache, but being completely unable to tell anyone. Your cat is in the same boat. Instead, she'll start eating less, seem lethargic, maybe refuse her favourite treats, or suddenly prefer soft, wet food over dry kibble. She begins associating the act of eating with pain. Ignoring this issue leads to weight loss, dehydration, and systemic infections. Critically, These bacteria can travel through the bloodstream and infect vital organs like the heart or the kidneys. That's why regular oral exams by your vet and professional anaesthetic dental cleanings when needed are not a luxury. They are a crucial necessity for your senior companion's overall health. If you think cats don't suffer from painful dental disease, trust me, they absolutely do, and they suffer in silence. Let's talk about water. You might think, what could be easier? Just fill the bowl and you're done. But the devil is often in the details. For a senior cat, adequate hydration becomes critically important, especially since chronic kidney disease, or CKD, is one of the most common issues facing aging felines. Dehydration accelerates kidney deterioration and significantly worsens their overall quality of life. Many older cats drink less due to a reduced sense of thirst or because it's simply painful to bend down to the bowl due to arthritis. So what can you do? First, place multiple water bowls throughout the house, especially in your cat's favourite resting spots. Second, make sure the bowls are wide and shallow. This prevents whisker fatigue, which happens when their sensitive whiskers touch the edges, a common irritant for many cats. And third, strongly consider purchasing a pet fountain. The sound and movement of running water instinctively attracts cats and encourages them to drink more. And finally, always prioritise water freshness by changing it daily. These simple steps can significantly extend and improve your senior pet's quality of life. Here's a well-intentioned mistake people often make. He needs to move more. Remembering our cat as a playful kitten, we try to rouse them, making them chase a laser pointer or a wand toy, just like in the good old days. But for an elderly cat dealing with arthritis or other age-related issues, that kind of vigorous activity isn't fun. It can be actual torture. Of course, moderate physical activity is crucial for maintaining muscle tone and joint health, but it absolutely must be adapted to the animal's current capabilities. Instead of encouraging crazy races, offer calm, ground-level games that don't require jumping or sharp movements. You can simply roll a small ball across the floor or slowly drag a teaser toy. Watch their reaction closely. If your cat tires quickly, lies down, or starts showing irritation, stop the game immediately. By forcing activity, you're not only causing them pain, but you can also induce stress and create negative associations with both playtime and your presence. The next common mistake involves our perception. We see an accident right next to the box, and our first thought is, "You spiteful little old cat! You're doing this just to annoy me." Punishing an elderly cat for having an accident outside the litter box isn't just pointless, it's genuinely cruel. 99% of the time, this behaviour has absolutely nothing to do with spite or malice. It is a cry for help. The cause is likely a medical issue, a urinary tract infection, kidney stones, diabetes, or arthritis, which makes it simply painful for the cat to climb into a box with high sides. It could also be cognitive dysfunction, a kind of feline Alzheimer's, where the animal simply forgets the location of the litter box. Instead of getting angry, your first step should be taking your cat straight to the vet to rule out any underlying medical conditions. Once you're home, think about how to ease her life. Place several low-sided litter boxes in easy-to-access locations. Punishment will only heighten her stress and ultimately make the entire problem worse. Following up on the topic of comfort, let's address a common mistake in spatial organisation. The home that was once an ideal playground for a young cat can easily transform into a difficult obstacle course for a senior feline. High windowsills, those favourite spots on top of the wardrobe, and the perches on the very top of the cat tree, they all become inaccessible when their joints ache and their strength starts to fade. To ignore this is to deprive your cat of their most cherished and secure resting places. Imagine the sheer disappointment of wanting desperately to jump up onto that sunny spot on the window, but simply not having the physical ability to make the leap. The solution is straightforward. Adapt the environment. Place small steps, ramps, or even just a sturdy ottoman next to the couch or the windowsill. Ensure food and water bowls are set directly on the floor, not on a high platform or stand. And the litter box, as we mentioned earlier, must have a very low entry point. By creating this barrier-free environment, you not only alleviate your cat's physical suffering, but you also demonstrate your deep care, preserving their sense of dignity and self-confidence. Another common mistake is neglecting your cat's grooming needs. We tend to assume that cats are naturally meticulous and can manage their coats themselves. While younger cats certainly can, as they age, many develop arthritis, which makes it painful for them to bend and reach their back or tail. Their flexibility just isn't what it used to be. As a result, their fur becomes matted, forming painful tangles that pull the skin and cause constant discomfort. Underneath these mats, the skin can become moist and irritated, which often leads to dermatitis and serious infections. This is why your senior cat truly needs your assistance. You should regularly, but very gently, brush your cat using a soft brush. This will not only keep their coat tidy, but also serves as a pleasant massage, helping to improve their circulation. If mats have already formed that you cannot gently brush out, never attempt to cut them out with scissors. It is incredibly easy to accidentally injure their delicate skin. Instead, it is always best to consult a professional groomer or your veterinarian. The most dangerous mistake we can make is attributing every change to old age. Is your cat moving less? Well, she's old. Has she become irritable and won't let you pet her? Her personality is just changing with age. Is she hiding and avoiding interaction? She just wants peace and quiet. Remember this once and for all. Old age is not a diagnosis. It is merely a stage of life. But the symptoms you just listed, those are classic signs of chronic pain. Your cat can't come right out and say, "Hey, my back hurts." But she will show you through her behaviour. Changes in gait, reluctance to jump up onto furniture, aggression when certain areas of the body are touched, or constantly licking the same spot. All of these can indicate arthritis, spinal issues, or other painful conditions. If you notice any of these signs, don't brush them off. Schedule a vet appointment. Modern veterinary medicine offers a wide range of safe and effective pain medications for cats that can genuinely restore your pet's comfort, mobility, and overall joy in life. Closely related to our last point is the common mistake of assuming they are just sleeping a lot. Yes, senior cats certainly sleep more than their younger counterparts, but it's crucial to distinguish between healthy rest and true lethargy. If your cat is sleeping more than usual, but when they are awake, they are active, curious, have a good appetite, and interact normally with you, chances are everything is okay. However, if they sleep nearly constantly, are difficult to rouse, seem apathetic, and show no interest in food, toys, or even your affection, that is a serious red flag. This kind of excessive drowsiness and sluggishness can be a symptom of numerous conditions, ranging from heart failure and anemia to severe infections or even cancer. Never ignore a sudden, dramatic shift in their sleep-wake schedule. It is one of the clearest indicators that something fundamental is wrong in your cat's system. It is always better to get that extra checkup and confirm everything is fine than to lose precious time by waiting. Do you actually listen to what your cat is telling you? We're covering mistake number 11, ignoring changes in your cat's vocalizations. If your typically quiet cat suddenly becomes loud and overly talkative, especially at night, don't just write it off as an old age quirk. There could be several reasons for this, and all of them demand your attention. First, it might be a sign of pain. Your cat is attempting to communicate their discomfort. Secondly, as cats age just like people, their hearing or vision can decline. They might start meowing louder because they can't hear themselves well. Or they might feel disoriented in space and be calling out for help. Thirdly, it could be a symptom of feline cognitive dysfunction, often referred to as cat dementia. Your cat might be confused, unsure of where they are, and experiencing anxiety. Finally, increased vocalization is one of the classic signs of hyperthyroidism, a common thyroid gland disorder. In any case, if your cat has suddenly become a lot more talkative, it's a clear signal that it's time for a vet visit. The next mistake we often make is depriving our cats of mental stimulation. We give them a cozy bed and tasty food, and assume that's all they need. But a brain that isn't challenged begins to fade, and that rule definitely applies to cats. For senior pets, a lack of mental exercise can accelerate the onset of cognitive dysfunction, leading to apathy and even depression. Cats that can no longer actively hunt or chase toys need different kinds of entertainment. Get interactive puzzle toys where you can hide treats and make them work for a reward. Simple, regular interaction, talking to them, gentle petting, and just spending time together counts as stimulation too. Even something as simple as opening a window, always supervised of course, so your cat can watch the birds and listen to the sounds outside, that is already enriching their environment. Your pet's brain needs exercise just as much as its body does. It is our job to make sure we provide them with those essential mental workouts. It's a common misconception that senior cats are immune to stress. Quite the opposite is true. As they age, their nervous systems' adaptive mechanisms weaken, and things they once handled easily can now turn into a major shock or trauma. Loud music, noisy guests, home renovations, or the arrival of a new baby or pet, all of these present immense stress for an elderly animal. Stress, in turn, compromises the immune system and can easily trigger flare-ups of chronic conditions such as cystitis or gastrointestinal issues. If you anticipate major changes in your household, you must try your best to shield your cat from the disruption. Ensure they have a quiet, secluded refuge, a safe space where they won't be disturbed. You should also consider using calming pheromone diffusers. And whatever you do, never introduce a new, active kitten in the hopes of perking up your senior cat. More often than not, this strategy only leads to chronic stress and a deterioration of the senior cat's overall health. Let's take a look at their paws. A common oversight, and one often forgotten, is neglecting proper claw maintenance. Senior cats move less, climb less, and use their scratching posts less frequently. As a result, their claws don't wear down naturally, and they become very long and thick. But this isn't just a cosmetic issue. Overgrown claws can curl around and actually grow into the paw pads, causing sharp pain with every step. This can lead to serious inflammation and infection. The cat starts limping and moving even less, turning the situation into a vicious cycle. Additionally, long claws constantly snag on carpets and furniture, which can lead to serious injury, like a sprain, a dislocation, or even a fractured toe. Therefore, regular inspection and trimming of a senior cat's claws are absolutely essential hygiene procedures. If you are nervous about doing this yourself, remember that any veterinary clinic or professional grooming salon can always assist you. The next common mistake stems from a simple misunderstanding. Your senior cat might start cuddling less, stop jumping onto your lap, or even walk away entirely when you try to pet her. Naturally, we jump to the wrong conclusion. She doesn't love me anymore, or she doesn't need my attention, but that couldn't be further from the truth. Elderly cats need our love and affection just as much, if not more, than they ever did. However, their methods for showing and receiving that love begin to change. It could be painful for her to jump on your lap because of arthritis. Perhaps a specific spot on her body is sore, and your usual petting is now causing discomfort. Or maybe her vision or hearing has declined, and your sudden presence simply startles her. Don't despair, and please don't take it personally. Simply become more observant. Try sitting on the floor near her. Speak to her using a calm, soft voice. Offer affection slowly and watch for her reaction. Maybe she now prefers gentle chin rubs or scratches behind the ear, rather than a full stroke down her back. Your goal is to find a new language of love, one that is both understandable and comfortable for you both. Crucially, we must address thermal comfort. The common oversight is forgetting that older pets lose efficiency in their ability to regulate body temperature. They get colder more quickly and are much more sensitive to drafts. Senior cats often have less muscle and fat mass, which once helped insulate them. Furthermore, cold temperatures intensify the pain associated with arthritic joints. Therefore, one of our main priorities is ensuring your cat has multiple warm, comfortable and cozy places to rest. Place soft blankets, heating pads, or specialised heated beds in her favourite spots, especially on cold floors or windowsills. Double-check that her primary sleeping area is completely free of drafts. You might already notice your cat actively seeking out heat, like cuddling up near a radiator or lounging in sunbeams. Help her access these warm spots easily. Creating these warm comfort zones throughout the house is a simple yet extremely effective way to show your care and significantly improve her overall well-being. Sticking with the topic of the litter box, let's talk about a very specific mistake pet owners often make: choosing the wrong type of box. We might buy the most modern, expensive covered or hooded box, thinking we're providing the best for our cat, when in fact, we're just creating an unnecessary obstacle. For a senior cat suffering from arthritis or mobility issues, that high lip or rim on the box is a serious, painful barrier they struggle to climb over. Furthermore, a covered box can feel cramped, dark, and trap odours inside, which will immediately deter any fastidious animal. The ideal litter box for a senior cat needs to be large enough for them to turn around comfortably, open to prevent odour build-up and claustrophobia, and, most critically, have at least one very low side or a specialised cut-out entry point. You may have to sacrifice aesthetic design in favour of pure functionality. Trust me, the trade-off, a clean floor, and your pet's comfort is absolutely worth it. And finally, always remember to place several of these accessible boxes throughout different areas of your home. This should go without saying, but tragically, this mistake still happens. Never, under any circumstances, give your cat human medication. When a cat is limping or seems lethargic, some owners are tempted to reach into their own medicine cabinet for a tablet of acetaminophen, paracetamol, aspirin, or ibuprofen. This is absolutely crucial. Don't do it. A cat's metabolism is wired completely differently than ours, and many human medications are, quite simply, deadly poison. For instance, just one tablet of acetaminophen can cause severe liver damage and be fatal. NSAID pain relievers, such as ibuprofen, can cause severe stomach ulcers and lead to acute kidney failure. If you suspect your cat needs medical help or pain relief, the only safe and correct path is to immediately call your veterinarian. Only your vet can provide a diagnosis and prescribe safe, effective medications specifically formulated for cats. And finally, the 20th mistake, which essentially encompasses many of the previous points: fatalism. This is often captured by the phrase, "What do you expect? They're old." When faced with the challenges of an aging pet, many owners simply throw up their hands, viewing any new symptom as an inevitable decline. They avoid taking their cat to the vet because they feel it's too late to fix it, and they don't try to manage the pain because they assume the end is coming soon anyway. This is the biggest and perhaps the saddest mistake of all. It is true that we cannot cure aging itself, but we absolutely can and must treat the conditions and diseases that accompany old age. Arthritis, hyperthyroidism, chronic kidney disease, dental problems, high blood pressure. The vast majority of these conditions are successfully managed and controlled with modern veterinary medicine. Proper treatment and specialised care can give your cat several more years of high-quality, comfortable and truly happy life, right there by your side. To give up the fight is to abandon the one creature that trusts you entirely and completely. This brings us to the single most critical mistake an owner can make: skipping those vital preventative checkups. Many owners reason, "My cat looks fine. They're eating and drinking normally. Why put them through the stress of an unnecessary trip to the vet?" This line of thinking could cost your beloved pet their life. As we've mentioned before, cats are masters of disguise. By the time you notice obvious symptoms of illness, the condition is usually already advanced. For senior pets, veterinarians strongly recommend a full wellness exam, at least every 6 months. This checkup should go far beyond simple palpation and listening. It needs to include a complete blood panel, that's a CBC and chemistry profile, a urinalysis and blood pressure measurement. These screenings are crucial because they allow us to catch serious conditions like kidney disease, diabetes or hypertension in the earlier stages when they are still highly manageable. To skip these checkups is essentially playing Russian roulette with the health of your most loyal companion. So, we've broken down 20 of the most common, and unfortunately sometimes fatal, mistakes we make when caring for our senior cats. We covered everything from proper nutrition and essential vet visits to optimizing their environment and even shifting our own perception of an aging pet. The single most important takeaway we can have is this: just old age is not a diagnosis. It is often an excuse for our own inaction. Underneath that blanket term usually lie specific conditions that are treatable or manageable, things like arthritis, chronic kidney disease, hyperthyroidism, and painful dental issues. Our cats are master stoics. They will tolerate discomfort and mask their pain until the very last possible moment. As loving and responsible owners, our job is to be their voice, their advocate, and their personal detective, noticing the smallest behavioural shifts and sounding the alarm right away. Thank you so much for sticking with us until the end of this important video. If you learnt something new or perhaps recognised some of your own mistakes, please don't beat yourself up. The only thing that matters is the commitment to learn and start doing things right starting now. Please hit the like button on this video to help more cat owners see this vital information, and be sure to subscribe to the channel so you don't miss our next helpful guide. Now, a question for you. How old is your feline senior? What age-related changes have you already encountered? Share your story in the comments below. Let's help each other with advice and build a supportive community.